विद्वांसः समागताः विचारयन्ति सुश्रुतं पथ्यं च हितमेव च. Blessed in this noble confluence of health and wisdom, where learned minds gather to reflect on well-being, healing, and greater good. It is my humble honor to welcome each one of you to the Med Harmony 2025, a confluence of healthcare leaders. This evening, we stand united not merely as professionals, but as change makers committed to reshaping the future of healthcare with compassion, innovation, and collaboration. This is no ordinary gathering. It is an exclusive summit of those who define the medical ecosystem of Bharat and beyond. Med Harmony is envisioned as the space where thought leaders inspire, disruptors spark the dialogue, and institutions find synergy. We will listen to pioneers who are pushing the boundaries of AI in healthcare, making diagnostics more affordable and placing the patient at the very center of the care journey. Let us open our minds, connect with the purpose, and let us co-create the healthcare narrative of tomorrow, right here, right now. Ladies and gentlemen, before I begin with this evening, I would like to share a small video with all of you, which will give you a better understanding of the concept behind Med Harmony. I request my technical team to kindly relay the curtain raiser video.
An unprecedented gathering of over 500 doctors across 50+ specialties for the first time in Bharat. Welcome to Med Harmony 2025, where the future of healthcare meets the power of collaboration. Led by an eminent organizing committee of visionaries, thought leaders and pioneers, ready to shape tomorrow's healthcare narrative. Dive into transformative themes: AI in healthcare, medical tourism in Bharat, medical technology and innovation, health insurance and hospital performance. This is more than a conference. It's a movement for healthcare innovation. Med Harmony, where science meets soul. Med Harmony honors the hands that heal, the minds that innovate, and the hearts that care. Welcome to Med Harmony 2025.
Thank you very much for that beautiful video. My friends, I'm sure that this video would have made the concept behind Med Harmony very clear to all of us. It is with great honor and a heartfelt warmth that I welcome our esteemed dignitaries this evening at Med Harmony 2020. My friends, it is observed that we all, may it be our fraternity of education, may it be the fraternity of medicine, or even sports for that matter, it is seen that we have unfortunately compartmentalized our professions. We have seen that the doctors of various specialities or departments, as we say, focus their work, their career on that particular specialty, and the angle or the perspective of co-creation is sometimes missed. In academics, usually the School of Business and School of Pharmacy needs to come together to co-create something new, something disruptive. The similar thought comes from every walk of life. But unfortunately, it has been observed that we are confined by our silos. The Med Harmony 2025 is the confluence where we will try to break these silos and we will come together to co-create the future for Bharat and for entire world. This is just a beginning, my friends. I'm sure you will all understand as we progress in this evening today that the thought leaders and the work that they have done in their respective careers. Let us try to talk to each other in the free time that we'll get this evening, and let's keep the aim in mind to co-create the new thoughts and disruptions for time to come. In a few moments from now, we will formally begin with the inauguration of Med Harmony 2025. Thank you. Thank you. It is with great honor and heartfelt warmth that I welcome our esteemed dignitaries this evening at Med Harmony 2025. We are privileged to have joined with us some of the most distinguished leaders in the field of healthcare. Please join me in welcoming Dr. Nageshwar Reddy ji, the chairman of the Asian Institute of Gastroenterology and AIG Hospitals, Dr. A.V. Gurava Reddy ji, Managing Director of KIMS Sunshine Hospitals, Dr. A. Velumani ji, founder of Thyrocare Technologies, and Dr. Devang Modi ji, the Director and CEO of Bajaj Finserv Health Limited. We are proudly honored to be joined by our organizing committee members and respected dignitaries like Dr. P.K. Grant, Shri Jahangir H.C. Jahangir, Dr. Aditi Karad, Dr. Parag Sancheti, Dr. Rahul V. Karad, Dr. Sanjay Kulkarni, Dr. Shirish Prayag, and Dr. Sanjay Lalwani. Your presence elevates this platform and inspires meaningful conversations for the future of healthcare. I would like to request each one of you to join us on stage for for lighting the traditional lamp.
Good afternoon, everybody. I'm Dr. Parag Sancheti, one of the organizers for this meet. We will be just starting in about a few minutes. We are waiting for Dr. Nageshwar Reddy. He's already in the hotel, and he will be joining us in the next few minutes, and we will start this program shortly. So just bear with us for 2 to 3 minutes more.
An unprecedented gathering of over 500 doctors across 50 plus specialties for the first time in Bharat. Welcome to MedHarmony 2025, where the future of healthcare meets the power of collaboration. Led by an eminent organizing committee of visionaries, thought leaders and pioneers, ready to shape tomorrow's healthcare narrative. Dive into transformative themes: AI in healthcare, medical tourism in Bharat, medical technology and innovation, health insurance and hospital performance. This is more than a conference. It's a movement for healthcare innovation. MedHarmony, where science meets soul. MedHarmony honors the hands that heal, the minds that innovate, and the hearts that care. Welcome to MedHarmony 2025.
My friends, as we begin with this inspiring evening of MedHarmony 2025, I would now like to invite our esteemed dignitaries to come forward for the lighting of ceremonial lamp, a timeless tradition that symbolizes the dispelling of darkness and awakening of knowledge, harmony and healing. In our culture, I would like to request all the dignitaries to please join us on stage for lighting the traditional lamp. I would like to request Dr. Nageshwara Reddy ji, Dr. Guruva Reddy ji, Dr. A. Velumani ji, Mr. Devang Modi ji, Dr. P.K. Grant, Shri Jahangir H.C. Jahangir ji, Dr. Aditi Karad, Dr. Parag Sancheti, Dr. Rahul V. Karad, Dr. Sanjay Kulkarni, Dr. Shirish Prayag, and Dr. Sanjay Lalwani ji to join us on stage for lighting the traditional lamp. As this sacred flame is kindled, may it illuminate the path forward, compassionate healthcare and visionary leadership. Deepo Jyoti Parabrahma, Deepa Jyoti Janardana, Deepo Haratu Me Papam, Sandhya Deepa Namostute. Let us give a big round of applause, my friends, as the divine light has been lit by all the dignitaries present here with us. I would like to request everyone to please stay there. I would also like to request everyone in the front to please rise in their seats, as we are going to have a small prayer before we begin with this ceremony. I request everyone to please rise in their seats. I would also like to request everyone to kindly pay attention to the words of this prayer. This prayer does not talk about any caste, creed, religion, or any section of society. This prayer is a prayer to the Divine Almighty for the well-being of entire humanity. I request all of you to please fold your hands, close your eyes, and wholeheartedly participate in World Peace Prayer.
प्रतिपाद्या जय जय स्वसंवेद्या आत्मरूपा देवातुति गणेषु सकलार्थमति प्रकाशु म्हणे निवृत्तिदासु अवधारी बोधी गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुसाक्षात् परब्रह्मा तस्मै श्री गुरवे नमः। पूर्णमदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ॐ शान्ति शान्ति शान्तिः।
Thank you. I would like to request all the dignitaries to kindly accept the chairs in the front. Thank you. Thank you very much. It is my honor and privilege to now request and welcome the Executive Director of Vishwaraj Hospital, Trustee and Joint Secretary General of Myers MIT Group, Pune, Dr. Aditi Karad, to kindly propose the welcome address. Dr. Aditi Karad, the Executive Director of Vishwaraj Hospitals, is a passionate healthcare leader dedicated to affordable and accessible care. She has played a key role in building critical cardiac care services, extending quality treatment to underprivileged communities. Her compassionate leadership is reflected in initiatives like free cardiac surgeries for children and strong frontline support during COVID-19 pandemic. She also established the Vishwaraj Institute of Nursing and introduced DNB PG programs to advance medical education. In education, Dr. Aditi serves as Trustee and Joint Secretary General at MIT WPU, where she has driven academic reforms, infrastructure upgrades, and stronger industry partnerships to enhance student employability. As Executive Director of World Peace Schools, she promoted value-based learning, aligning with global standards. Her vision remains clear: better health, better education, and better future. Please put your hands together and welcome Dr. Aditi Karad.
On the behalf of organizing committee, I extend warm welcome to all the doctors and esteemed leaders from the healthcare and industry for attending MedHarmony. It is my honor to welcome Dr. Nageshwar Reddy, founder and chairman, AIG Hospitals, a renowned gastroenterologist, a distinguished entrepreneur, and the researcher. He is the first doctor who received all Padma Awards, Padma Shri, Padma Bhushan, and Padma Vibhushan. Welcome, sir. Dr. Guruva Reddy, Managing Director, Sunshine Hospital, a pioneer in joint replacement surgery who has set exemplary standards in orthopedic outcomes across India and Asia. Welcome to Dr. Guruva Reddy, sir, also. Dr. A. Velumani, founder of ThyroCare, an organization that made diagnostic services accessible to all. Mr. Devang Modi, CEO for Bajaj FinServe Health, an emerging health management platform. Welcome, all of you. Practicing medicine and working in the healthcare offers a profound opportunity to serve humanity, a sentiment I'm sure will resonate with every doctor. India is one of the fastest growing economies of the world, and healthcare sector is playing the pivotal role for this development. Indian healthcare market is projected to reach around $638 billion by year 25. Sector has experienced remarkable growth over past decade with a compounding annual growth rate of more than 17%. It is extraordinary time for healthcare, as rapid advancement in technology ranging from telemedicine to artificial intelligence are revolutionizing medical practices. These innovations are not only enhancing the diagnostic capabilities, but are also streamlining the workflows and ultimately improving the patient satisfaction. On similar lines, we are witnessing great transformations across many more areas of healthcare, be it pharmaceutical industry, medical technology, health insurances, medical tourism, and many more. However, we should not overlook the significant challenges which we are facing. With aging population and unfortunate distinction of being the diabetic capital of the world, Indian families are increasingly burdened by rising healthcare costs. Despite being world's most populous country, India allocates less than 4% of the GDP for healthcare, which is far less than many countries. As we navigate this evolving landscape, collaboration is essential. While many of us regularly attend the clinical specialty conferences to enhance our knowledge, there are few venues where we can discuss and deliberate on the broader aspects of healthcare that affects every stakeholder involved in the healthcare industry. MedHarmony is established with the vision to foster collaborations across specialties and disciplines. With more than 20,000 hospital beds, we take great pride in being part of Pune's healthcare ecosystem, which has emerged as one of India's premier centers for medical excellence. Largely thanks to the contribution of the private sector of Pune. It becomes very important for platforms like MedHarmony, where we can share the insights and concerns to address major challenges faced by healthcare providers across the specialties. Through our collaborative efforts, let us commit to embracing innovations, advocating for equity, and nurturing the cooperation. Together, we can create a healthcare system that addresses the needs of today while preparing for the challenges of tomorrow. I extend my gratitude to the healthcare leaders of Pune for coming together to establish this platform. Future of healthcare is promising and relies on our collective commitments. Once again, I warmly welcome you to MedHarmony, a confluence of healthcare leaders. Thank you.
Thank you very much, Dr. Aditi Karat. It is my honor and privilege now to invite on stage the Chairman and Managing Director of Sancheti Hospitals to share his thoughts on emphasizing on medical tourism. Dr. Parag Sancheti, PhD, FRCS, MS Ortho, is the Chairman of Sancheti Group of Hospitals and leading orthopedic surgeon specializing in knee surgery, arthroscopy, and joint replacement. He practices at SIOR and SAOC in Pune and serves as the Dean of PG College at SIOR. He is visiting faculty at the University of Dundee and McMaster University, Canada. He has held prominent roles in the national and international organizations, performing over 1,000 knee replacement and 800 arthroscopies annually. He has authored multiple books and 50+ publications. As an orthopedic consultant to Oman's Ministry of Health, he actively contributes to the international clinics, medical tourism. His numerous honors include the ET Inspiring Orthopedician of India and Pune Times Mirror Hall of Fame Award. Currently, he is a Senate member of Maharashtra University of Health Sciences. His legacy is innovating the orthopedic care, promoting global education and philanthropy. Please put your hands together and welcome with a big round of applause, Dr. Parag Sancheti.
A very, very good afternoon to each and every one of you in this hall. It's my proud privilege to be present here in front of you today and address this august gathering. On the outset, let me welcome our invited guest speakers, Dr. Guruva Reddy from Hyderabad, Dr. Nageshwar Reddy, Dr. Velumani, and Mr. Devang Modi. Aditi ma'am has just given you a little brief about them, and you will hear them personally speak, and we'll have great interaction as this program advances. As the people were coming in, the doctors were coming in, everybody was asking me one question. Parag, what is this Med Harmony about? What's the idea behind this? Why is this started? And many such questions. So let me, clear all your doubts and answer your questions. Rahulji Karad and Aditi ma'am, we met about 3 to 4 months ago. And just while talking to each other, Rahulji said that why not, we should start one program, one platform where all the doctors of various specialities come together and have some discussions. Each one has their own organizations, like we have the Pune Orthopedic Society, there's an Ophthalmic Society, Gynec Society, but this particular platform, Rahulji's vision was to get all of you together and have some discussion on common topics which are there and which we cannot discuss in our regular platforms or forums. So that is the way it was formed. And joining him in his vision was the dynamic, lovely lady, Aditi ji, who really took forward this. And for the last 3 months, she has been working hard, working on this. And ultimately, Rahulji's and Aditi's vision is becoming a reality today. And I'm so happy to see all of you sitting here in this hall, which is nearly full. So a big round of applause for Rahulji and Aditi ji for really forming this together. So once this started, there was the entire organizing committee. You can see all the people here, Dr. Grant, Dr. Jahangir sir, Sanjay ji Kulkarni, Shirish Prayag, and our own Dr. Lalwani from Bharati Vidyapit. All of us met many times. There was many meetings, Zoom meetings. Dr. Pathan from Vishwaraj Hospitals went to each one of them and got together their ideas. And today's show is a culmination of all the planning which has happened in the last 3 months. So this is the whole idea, and we want to make this an annual affair with the blessings of Rahulji. I'm sure this will happen. And many more such programs also can be done, not only annually, but on various occasions in Pune. Talking about the various initiatives taken by the MIT group, we know Rahulji is the managing trustee of the elite MIT group, and one of his vision and his claim to fame has been the MIT School for Politicians. And this is something for the first time he started the MIT School for Politicians, where till now he has trained more than 1,000 students. There was a get-together a few years ago when more than 2,000 MLAs from all over India attended the conference, and there was great discussion on that platform, and there have been students, more than 500 who have passed out, and 8 of them are standing MLAs today. So that's a big, big honor. We are so happy with this initiative, because I'm sure in 15 years, his vision is that there should be more than 2,000 MLAs who have passed out from his school. And that will change the future of India, I'm sure. And Rahulji, we congratulate you and compliment you for this particular accomplishment. They have trained more than 1 lakh students till now. They have presence not only in Pune, but other cities. And we are really happy that the MIT group has taken this initiative to start the Med Harmony, and we are seeing the first meeting. I was told to speak a little bit about the medical tourism. I won't take much time because we have a panel discussion and we are going to have more questions then. But Pune has historically been known as a very cultural city. We have programs like Savai Gandharva. It is known as the Oxford of the East because of institutes like MIT, Bharati Vidyapit, Symbiosis, and there are so many students, coming to Pune to study. And now, Pune is being known as also a healthcare destination. I think that's a great thing because we do get a lot of patients coming from the Middle East, from Southeast Asia, and also from South America and certain parts of Europe for treatment to Pune. This has largely been because they don't have insurances there. The waiting lists are very long in the UK. And of course, even though there may be great infrastructure in the Middle East, they don't have great expertise. And Pune, which has now more than 18 multi-specialty hospitals with more than 500 beds, and a total bed strength of more than 28,000 in Pune. I think Pune is definitely set to become the healthcare destination for one and all. So that is why, medical tourism, which took a little backseat during COVID, is now becoming popular, and in the panel discussion, we'll speak more about it. I don't want to take much time of yours, but I want to thank you for coming here on for this program and honoring the invitation. Dr. Pathan and the whole Vishwaraj group doctors have been really working hard. We compliment them, and really I'm looking forward to this program as much as you are. Thank you very much for your kind attention.
Thank you very much, Dr. Sanchethi, for your words. It is now my honor and privilege to welcome on stage the Chief Cardiologist and Chairman of the Cardiovascular Services and Managing Trustee of Ruby Hall Clinic, Pune, Dr. P.K. Grant. He leads the Ruby Hall Clinic's 700-bed cardiac center established by his father, late Dr. K.B. Grant, and is credited with performing India's first angioplasty. Across 4 hospitals, 900 beds, his team has conducted over 150,000 angioplasties and 80,000 bypass surgeries. He has organized 45+ international cardiology conferences, published 120+ international papers, and holds fellowships with FSCAI, FACC USA, CSI, and the Asia Pacific Society of Interventional Cardiology. Ruby Hall also runs 20 diagnostic centers and is acquiring 2 new hospitals in Mumbai and Amanora, Pune. He has enabled over 400 free heart surgeries for underprivileged patients. His legacy is cardiac innovation, global leadership, and compassionate care. Please put your hands together and welcome Dr. P.K. Grant.
Good afternoon, and thank you for inviting me here today. I'm very, very happy that Karat Saab has taken this initiative with his pretty wife to organize this function today. I'm going to be brief and talk a little bit about healthcare, especially the insurance section, because that's what I've been told to talk about. As far as India is concerned, only 51% of the population of India is insured. That leaves a huge gap of uninsured people, and nearly 40 to 50% of our population is still not insured in any way. 35% of our population is insured by the government, Anshuman Bharat scheme. Only 12% is in the private sector. Only 12% is in the private sector, and 4% is the ESIS. It is proposed that the Anshuman Bharat scheme will increase the insurance rate to 60% by 2026. As far as the urban population is concerned, nearly 65% are insured. As far as the rural is concerned, only 42. COVID came and went, but because of COVID, many more people have got themselves insured. Now, what are the problems with the insurance companies, and what are the problems with everybody? First of all, the cost of medical equipment. What is happening today, you can buy a CT scan for 50 lakhs, or you can buy a CT scan for 25 crores, and now there's a new CT scan come out, which is 50 crores. So technology is very expensive, but because of that, the cost keeps going up all the time. A 40 lakh CT scan, you can do a CT scan for 1,000 rupees, and you get away with it. But if you have a machine that is, say, 30 crores and 40 crores, you have to charge 18,000 rupees, otherwise you will never recover, and the insurance will never reimburse you. So there's always this problem between insurance and hospitals, which keeps going up and down. The second thing is a lot of fraud takes place, even in our hospitals. As you know, recently in Gujarat, there was a hospital that was doing angioplasty and charging insurance companies. Very unfortunate, and should have never happened, and should not happen this sort of thing again. So that also puts the cost of insurance higher and higher, which needs to be looked at. We also have a lot of problems now coming up with cybercrime. That is another area which pushes the cost up. For example, Ruby Hall got attacked by cybercrime 1 year ago. We had to shut down all our systems for nearly 8 to 10 days, 15 days, call the police, get it sorted out, and then we came back online one by one, because everything now is AI-driven. People are going to talk about AI. So this is another area where you have to be very careful, and this is where we need to be very, very careful. Sometimes I ask myself, why do you need to stay overnight in a hospital to get your insurance? Normally they say stay 1 day. Why do you need to stay 1 day? If a person wants to do a simple test like an angiography, he comes in, the angiogram is normal, he should be allowed to go home in the afternoon with the insurance claim taking it up. This is not happening. And because of this, insurance costs are going up. So I think there should be more daycare centers. We should have more daycare centers. We should have more telemedicine, because that reduces the cost. The person doesn't need to come home come to the hospital. He can do it through telemedicine. So these are the areas where I feel that we should definitely look at the insurance sector even more and more. I remember there is another area where we need to look at, as far as the insurance and all that is concerned, is the area of leakages. We are finding that security must be there for all the patients. I know that when a patient is admitted in a hospital, by the time the patient is there, everybody around knows the information about that patient. So this is some area where we need to also look at very carefully. Data should not be leaked out, especially from the insurance companies as well. So these are the few points I want to bring out today, so that we have satisfaction. The insurance companies work with the hospital. We try to bring the costs down and give complete satisfaction to all the patients. Thank you very much. I've been given 3 minutes, so I need to move it in 3 minutes. Thank you very much. Thank you.
Thank you, sir. Thank you very much for those thoughts. It is now my honor and privilege to welcome on stage the chairman of Jahangir Hospitals, Pune, Shri Jahangir H.C. Jahangir, who belongs to the renowned Jahangir family of Pune, known for their legacy in healthcare and philanthropy since 1946. He has transformed Jahangir Hospital into a state-of-the-art 350-bed facility while upholding the values of ethical care, patient-first service, and community commitment. Appointed as a trustee of the Sir Ratan Tata Trust in 2019, he has supported impactful initiatives across health, education, rural development, and social justice. His leadership blends the tradition with progress, continuing a legacy rooted in compassion, trust, and excellence. His legacy of compassion and trust and excellence will always be there. Please put your hands together and welcome with a round of applause, Shri Jahangir H.C. Jahangir.
Thank you for your kind words, and good afternoon, everyone. Rahul and I were talking about this many, many months ago, that we should get together, and there is one overarching purpose of meeting today, regardless of all the topics that are going to be discussed. And that overarching purpose is something that resonated with me extremely strongly, and that is one thing, and one thing is to celebrate all our wonderful doctors of Pune. It is something really of great pride that the doctors in our city are second to none, not just in the country, but second to none anywhere in the world. We are so grateful to them for what they do, and therefore I'd like to say something very basic, and that is about patient satisfaction. These are the torchbearers who provide the kind of satisfaction that the patient should have and deserve. we in our hospital practice a philosophy which we called patient first. I'm sure everyone does that, but we think about it as patient first. We think about it as all of us, be it a chairman, be it a security person, be it a HK person, is there for one person, one reason and one reason alone. And that is focus completely and entirely on the patient and their family. Equally important, their family, because quite often the family is more traumatized than the patient. So that is what we focus on. And we support our wonderful doctors, not to mention our wonderful nursing teams, to provide the kind of care that is deserved by the patients of our city and the region around. And it's very basic, it's simple, but it is something that needs to be focused on, and focused on at all times. Because as a colleague of mine said many years ago, that sometimes we get so busy running a hospital, because a hospital is really one of the most complex situations to run. Parvez will tell you also, every day is a new problem, and every day is a new solution. But a colleague of mine said that we should never get involved, get so involved in running the hospital that we forget about the patient. And therefore, we should keep our patient right in the absolute core of our vision, that we are there for that purpose and that purpose alone. And then the satisfaction will come, because along with it comes empathy, along with it comes passion. The empathy comes from the fact that each one of us need to put ourselves into the shoes of the patient and the family, and feel the trauma that they're going through, which is what causes us to empathize with that and provide the kind of patient care that we need to provide. And I'm sure if we keep focusing merely on that, apart from all the technology and the skills that we have, we will go even higher as a center for healthcare in Pune, as has been mentioned, and we are actually one of the finest. We have such good educational centers that provide us with so many doctors, and it's going to get better and better. But before I pass my 3 minutes, I'd like to also talk from a patient's perspective and what we would expect of patients. In our society, when we have a legal problem, the first thing we do is go to a lawyer. When we have a medical problem or when we feel a little unwell, we talk to our neighbor to find out how he feels. Then we talk to a friend and say, have you ever felt this? He says, yeah, maybe I did. Then we meet someone over a drink at a party and say that, have you felt this? What should I do? So he says that, oh, take this little portion. It really helped me. So we consider doing that. That doesn't help. And then we look at the internet, look at Google, read for about 15 minutes, try something there. That doesn't help. And then we go to a doctor. So really, it's really our responsibility as a society that just as we go to any profession, when we feel the need of that profession, the first thing we need to do is to go to that profession. And when we have the best doctors in the world right at our doorstep, why should we waste our time talking to so-and-so, reading this, trying this, when we have the best? So we'd like to celebrate you by asking our society to come to you immediately they feel that something is needed. And you, by the grace of God, are always there to help us. Thank you so much.
Thank you very much for your kind words, sir. And it is now my privilege to invite on stage the Director of Urological Hospital, Consultant Urologist, Dr. Sanjay Kulkarni, who's a globally renowned urologist and pioneer in reconstructive urology, best known for developing the Kulkarni urethroplasty featured in leading American textbooks. He heads Urological, a 100-bed advanced urology institute and global referral center. He has performed 150,000 urethroplasties, largest in India, authored multiple books and chapters, and led surgical workshops in 65 countries. He has served as the president of USI, SIU, and GURS, and is the recipient of the Dr. B.C. Roy Award and the Urologist Gold Medal. His contribution also features in Belly and Love and Hinman's Atlas of Urology, recognized globally as gold standard. His legacy is revolutionary urethral surgery, global teaching impact, lifelong dedication to urology. Please put your hands together and welcome, with a big round of applause, Dr. Sanjay Kulkarni.
Good evening. When I read Dr. Nagi Reddy, we know him for long time, more than 30, 40 years. His initial website said, this is a long time ago, we have performed largest number of ERCPs in the world. And now I'm very happy to see Dr. Nagi Reddy. We call him Nagi Reddy. And he is what can I say, world authority on gastroenterology. We are lucky to have him in India. Today, I'm going to take little liberty of talking about men's health to see what technology has done to us. This is our new hospital, 100-bed single specialty hospital, only third of its kind in India. One is in Hyderabad, AINU, and one is in Nadia. Every male has a prostate. As the age enlarges, then the prostate enlarges as age advances. So what happens is men have problems of passing urine, and currently TURP is a gold standard. I always want to tease my urology colleagues saying that how many urologists undergo TURP? The answer is very rare. That means what we advocate to the patient, we are not willing to do on ourselves. And the most important complication is what we call retrograde or a backward ejaculation. And the only 5% patients in the world are treated by HOLEP, that is a laser surgery. So this is a robotic Madigan prostatectomy. In this surgery, we preserve the patient's urethra. So there is no stricture, no bleeding, and this is the future of urethral surgery because I'm a urethral surgeon. I will just give you little statistics. America, with a population of 30 crore, has about 20 lakh patients of prostate. TURP is performed in about 3 lakh patients. So most of the patients receive medical treatment, which they stop after 1 year. And then 17 lakh patients, 6 times larger number than TURP, need some kind of treatment. So on the left, you can see there is a risk versus benefit. Medical treatment, risk is low, benefits are low. On the top, we have open prostatectomy, robotic, then HOLEP, aquablation, TURP, invasive. And in the middle, we have a lot of new technologies coming up. So Pune was the first in the country to have this Urological. On the left, you can see the machine. On the right, you can see a little probe there. So what happens is in the prostate, which is enlarged, under local anesthesia, within 5 minutes, we inject water vapor into the prostate. At 103 degrees, the prostate cells will die. The patient will go home in 2 hours' time, and then 1 week later, the catheter is out, and he's passing urine normally. There is no bleeding, and the patient actually can start working next day. This is the photo before surgery, and this is a photo after surgery. Most of my urology colleagues and surgeons don't believe that without removing the prostate, it really works. Second technique that is introduced now is called Urolift. You can see on the left, the prostate is enlarged, and something like a file binder with a thread and 2 tiny clips on both sides. We can also do this under local anesthesia, and the patient can go home within 1 hour, passing urine normally without catheter. This is fantastic. I did surgery on a 75-year-old ophthalmologist. He went home in 1 hour. Next day, his flow is normal. Lastly, we have something called as iTind. We had a 33-year-old patient coming from Oman and had 3 daughters, wanted more children, didn't want any surgery. He had poor flow, bladder neck obstruction. So we introduced this under local anesthesia, keep it for 7 days, take it out, and his flow becomes normal. This is the initial flow on the left side. You can see a flat curve, and then the flow really becomes very normal. So minimally invasive surgical treatment is offered to those patients who want to maintain normal ejaculation. And many patients are now living longer. They have multiple cardiac procedures like stents, bypass surgery. They are on anticoagulants, and many of them have low ejection fraction, not fit for surgery. So this is really useful for all patients. And now, more and more patients are undergoing prostate cancer surgery, and if they continue to leak, we offer them artificial sphincter, and if they have erectile dysfunction, we offer them 3-piece penile processes. With a squeeze of a button, he can get erection as long as he wants. So I would say that future of prostate surgery is urethra preserving as a urethra surgeon. So in one subspecialty of urology, so many advances have taken place, and this happens in everyone, like ophthalmology, orthopedics, gastroenterology, and I cannot enumerate all of them, so I have taken liberty to tell you something about urology. Thank you very much.
Thank you, sir. Thank you very much for that deep insight. And now, to introduce us to our next guest, I would like to invite on stage Dr. Shirish Prayagji, who's a renowned physician and pioneer of critical care medicine in India, trained at Charing Cross Hospital, London. He was the first from Pune to specialize in critical care, setting new standards in intensive care practices. He established Pune's first dedicated critical care unit at Prayag Hospital in 1980s and helped found the Indian Society for Critical Care Medicine in 1993, which now has over 15,000 members nationwide. Dr. Prayag's initiatives, including India's first mechanical ventilation workshop, have shaped national training standards. In year 2024, he received the ISCCM Lifetime Achievement Award for his lifelong contribution to critical care. His legacy is critical care visionary, medical educator, and life-saving leader. Please put your hands together for Dr. Shirish Prayag.
Thank you, ladies and gentlemen. And thank you, Rahul and Aditi ji Karad, for this excellent initiative. I think we needed a platform where people from different specialties who have excelled themselves in the practice in that city need to come together. This is basically to express our issues, like Parvez has very rightly mentioned, the issues related to insurance, the issues related to legal problems, ethical issues, and so many other issues keep cropping up in the practice. And we need a strong platform to not only voice them, but find innovative solutions. We could interact with the political leadership and take our issues at a higher level. And for all that, we needed a platform, and I'm really grateful to both Mr. and Mrs. Karad for this great initiative. I'm not going to talk anything about critical care, ladies and gentlemen. My job is extremely simple. My job is to introduce to you Professor Nageshwar Reddy from Hyderabad. And I think it's the simplest job on this earth, because Dr. Nageshwar Reddy needs no introduction, honestly. It sounds like a cliched phrase, but it is honestly true. He's a world-renowned gastroenterologist and pioneer in therapeutic endoscopy. He initiated and started the Asian Institute of Gastroenterology at Hyderabad. He has authored more than 1,000 research papers, contributed to 50+ GI textbooks, and invented the Nagi stent as well. He is the only endoscopist globally to receive 5 ASG Crystal Awards. And in India, he has earned the top honors, including Padma Vibhushan this year, Padma Bhushan, and Padma Shri. He has also received the Rudolph Schindler Award, WEO Lifetime Achievement Award and Captain's Chair from none other than Johns Hopkins in United States. Besides all this, his career continues to shape a large number of gastroenterologists across the country. I see a large number of budding gastroenterologists who pass out from their DNBs and DMs, vying to go to ASG to actually get some excellent trainings in the perspectives of gastroenterology, not just endoscopies, but a perspective in gastroenterology. And he has actually mentored a large number of them and thereby shaped the practices of gastroenterology across the country. So, ladies and gentlemen, it's our honor this afternoon to welcome Dr. Nageshwar Reddy on this stage.
Thank you very much. I would like to request Shri Jahangir ji to please join us on stage to felicitate and welcome Dr. Nageshwar Reddy ji. Please put your hands together and welcome with big round of applause Padma Vibhushan, Dr. Nageshwar Reddy ji. It is indeed our honor and privilege to have you here today, sir. And I would now like to request him to kindly address the gathering on the important topic of role of AI in patient care, transforming the future of healthcare.
Thank you very much. At the outset, I'd like to thank the organizers of Med Harmony for this very kind invitation. When I first got the invitation letter from Dr. Aditi Karad, it was a very unusual. I never got an invitation letter like this. It was signed by all the top doctors in Pune, the legends whom we know for many years. So when I saw this letter, I thought it was a fake letter. So because normally in Noho City, people all come together. So I rang up to two of my friends here in gastroenterologists in Pune, Parimal and Vinay. I don't know. They asked them, are you sure this letter came to me? They said, no, this is a very unusual conference. It's happening. Pune is probably the only city in the country where all the top doctors of different specialty come together to produce something like this. I think, Rahul, congratulations for this effort. I think it's a fantastic effort. So my role is to talk on AI in patient care. Any doctor, whichever specialty, whichever part of the country you are practicing it, whatever your status of practice, you have to know artificial intelligence. It's going to become a part of future of medicine. And let me briefly in the next 12 minutes show you why this is happening. I was a disbeliever of AI. About 3 to 4 years back, I thought, I was old-fashioned, very difficult to change minds beyond a certain age. I thought natural intelligence, human touch are very important. AI is just, hype that's being created by the industry. So I was a disbeliever. I did not know much about algorithms and so on. As you can see, this is my disclaimer. So when the talk like this came along, I would go to ChatGPT. And then I'd put in, I had to give this talk on AI, can you help me? And you see what ChatGPT says. Of course, the structured talk tells me what to talk, 3 minutes, 12 minutes, and so on. And finally, ChatGPT asked me, can I make the slides for you also? So I said, no, I'll make the slides myself. So this is the power of AI now. Now first 2 slides are just to introduce the doctors here, those who are naive to AI, what these terminologies mean. When you talk about artificial intelligence, the term was given in 1956 in UK, where at that point of time, they just meant that machines thinking like human beings. That was, and even after the last so many years, we still have a very vague definition of artificial intelligence. Machine thinking like human beings. Then came machine learning, where we could actually teach the machines to start absorbing the knowledge and thinking like us. And finally, the last part of artificial intelligence is deep learning, where you put in multiple inputs, number of questions, and you come out with the final output like I showed you in ChatGPT. So this is the deep learning, and what all we are doing in artificial intelligence is called the deep machine learning, and that is what we're using. So before I actually go into how we use artificial intelligence in our hospital, it's important to know three important things. If you know this everything you'll know about artificial intelligence. The artificial intelligence has foundation models, and there are three foundation models. The first foundation model is the language model, where large language models, where you can, the AI, you ask a question, it goes into internet, goes in different areas and collects all the information, and within seconds gives you an answer. This is called the large language models. An example is ChatGPT. The second model, or the algorithms, are computer vision. You show a picture to AI, and it will identify this is a man, this is a lady, this is a cat, and so on. So this is the second, computer vision. And this is where all the doctors have been using AI, and unfortunately, this is the least important part of AI. And we thought this was AI. The third part of AI is a natural language processing, NLP, where you talk and your speech is now given back to you in a printed form in a text which is segmented, introduction, names, and so on. So these are the three important components that we as doctors should know. So ChatGPT told me this, that I asked ChatGPT, where are AI being used? Diagnostic image analysis, drug discovery, and so on. Of all this, I think the future of AI in medicine, the most dramatic effect is going to be in drug discovery. The reason is that normally to discover a new drug, it takes us about usually 20, 30, 40 years. But using AI, now they're coming up with drug discoveries in 3 years, 4 years. So the whole pharmaceutical industry is going to dramatically change. So there are three important areas where AI is going to make a difference. For the clinician, you get a rapid diagnosis. For the whole health system, the efficiency is going to increase. And of course, for the patient, you actually promote personal health. So let me show you quickly the example. And when we started we introduced AI in a hospital a couple of years back. We got Google, Amazon scientists, were very expensive. So people said, why are you doing this? And our doctors were very upset. They said, you're getting AI, are you replacing us? I said this, AI is not going to replace doctors, but doctors who know AI are going to replace doctors who do not know AI. So remember this, if you know AI, you'll be a superior doctor compared to somebody who doesn't know AI. So let's look at these 4 areas where AI is useful. The first area is health service management, where you can do, I think those who are running hospitals know how optimization of operational efficiency, supply chain, and so on. One of the inefficient things that we do in our practice is when we talk to the patient, we're supposed to talk for 20 minutes, see the patient. The last 10 minutes of this, unfortunately, is patient repeatedly asking us questions like, how many tablets, should I take it before breakfast, should I take it after, all sorts of questions and inquiries. So to overcome that, why should we as doctors do that? We are specialized, we don't have to. We created what we call the MIRA, the Medical Information Robotic of AIG. And Mira.
Hello, everyone. I am Mira, the medical information robot at AIG hospitals. I am your future healthcare companion and here to change the way we think about healthcare. I have been meticulously designed to assist doctors, empower nurses, and most importantly, ensure that patients receive information in a faster and better way. I will assist patients and healthcare professionals, but never replace them. My goal is to enhance patient experience with human oversight and in the future. With appropriate training, my role may increase for evidence-based circumstantial requirements. I look forward to learning from the clinicians' experiences to continuously enhance my skills in the field of gastroenterology and other specialties.
So now what we have done is put Mira everywhere in the OPDs and all that. And also now we are using it to train our junior doctors because Mira has all the information, complications of ERCP. She'll tell you better than a doctor. And more important is, last 10 minutes of my interview, I don't have to the doctor, don't have to talk to the patient. Now patients know Mira is there. And as soon as they finish, they immediately tell me, okay, my doubts I'll go and ask Mira, because Mira is also better looking than me. So they probably want to interact with Mira. So this is something that we found dramatic, very easy to do. It is a large language model, like a ChatGPT model. Anybody can create in your hospitals, and it can be a very good hospital assistant for us. And look at this, our engineers did this, what we call the iSave. The reason is that I think, again, those who are running the large hospitals will realize that you get these code blues coming in very fast. And on average, we used to get 6 code blues in our hospital a day, out of which 2 patients we could not rescue, only 4 we could rescue, so 2 out of 4 were dying. So what we did was we created this iSave software where all the parameters, there are 6 parameters you can feed into. Anyway, they are on the hospital charts, the nurses are feed. They go into a EMR. And when they come to a critical level, about 4 are abnormal, then the iSave immediately warns the nurse and doctor, and med team goes in, and there's no, they can save the patient even before they go to the final stage. After we introduced this for the last 6 months now, we are not having a single code blue, can you imagine? It's dramatically changed. And which means not that we are not disturbed, it means that we are saving every day 2 patients' lives in the hospital. I think this is very important. And look at this also. We have about 1,500 surgeries going on in our hospital, and when a patient comes for surgery, he has to go to so many things. Again, surgeons, you go for pre-surgical checkup, X-ray test, ECG, cardiology, pulmonology. So we did an AI mapping of how many places the patient, it's called the spaghetti graph. The patient has to touch about 20 points before. So what was happening is about 20% of our patients were dropping out. They're not coming for surgery, because after doing all this, they're tired and they don't want to. So we asked our AI engineers, what shall we do? The answer was very simple. They said, the AI said, why don't you make a single block where all this can be done in a single. It looked very simple, but not simple, because when you make a single block, you have to calculate what is the equipment required, what is the economy of that scale, and all that. And it said, you make a single block, you will realize that you don't lose any money, you'll actually make a profit. We did that. We made an EIG pre-surgery. The patient comes in at 9 o'clock, gets everything done by 12 o'clock, and gets a nice cup of coffee and a cookie. And what we found was our dropout rate has become less than 1%, 20% is that. So therefore, we're actually not losing money, saving money by putting all this in. So this is, the second thing is predictive medicine. This is another important thing we did with AI. All the patients coming to a hospital were actually given, say, different prescriptions by different doctors. What we did is we took all the patients who were given more than 4 drugs, and then these patients went through a pharmacogenomics. This was a study which we are publishing in the New England Journal shortly. They went through a pharmacogenomics, and when they did the pharmacogenomics, we found that 40% of our prescriptions in the hospital, any hospital, is wrong. The doses are not correct because the genomic pathways are different in different patients. CYP2C19, the enzyme which actually metabolizes this drug, is dramatically different in different patients. And we found that drug-drug interactions are different. So when we looked at this, this pharmacogenomics is just costing 5,000 rupees, once in a lifetime done. So now we advise all our patients taking more than 4 drugs, undergo pharmacogenomics. You'll get a pathway. Instead of giving clopidogrel once a day, you may require once in 2 days. So things that have changed, and we know that we can't combine certain drugs. So this predictive medicine is going to become very important. And look at this. This is one of the commonest conditions we now have in gastroenterology is non-alcoholic fatty liver disease. The diagnosis of non-alcoholic fatty liver disease is made by FibroScan, very expensive, costing the patient 10,000. So what we did a prediction, NAFLD prediction dashboard. We're just taking 4 blood parameters. We made an algorithm which can accurately predict what is the fibrosis and what is the fat in the liver. And you can see the FibroScan report is exactly like our prediction report. And this costs 0. Just take the blood parameters, and now the government of India is now taking it up in a large scale, and they're now doing it to see whether, because the advantage of this is you don't have to have this costly FibroScans costing 2 crore rupees in the villages. You can just take the blood sample, and all over the country you can now estimate. So now we are doing a national study where we are estimating the incidence of NAFLD, fibrosis and steatosis all over the country. Very important data that is going to come out. So it's simple. And then of course, the patient data and diagnostics. Again, this is another important thing. We found that when we are seeing our patients, unfortunately we are losing contact with the patient. Eye contact is lost. We are just typing on our computers all the time because EMR is very important. Hospital administration saying do EMR is very important because it requires data. So we're losing the eye contact. So we made what is called the prescription recorder intelligent summary, the PRISM, where you can see.
सर पेट में बहुत दर्द हो रहा है सर एंड इधर बहुत क्या पेन आ रहा है सर
कितने दिन से हो रहा है?
2-3 मंथ से हो रहा है सर.
2-3 months.
Yes, sir.
और जो जलन हो रहा ज़्यादा छाती में.
Yes, sir. ज़्यादा हो रहा है, sir.
Nausea या vomiting.
So you can see,
yes,
I'm
sir.
looking at the patient all the time. I'm not looking at the computer. There's a computer there, but I'm not looking at it.
Stools normal.
Yes, sir.
कुछ problems है past में कुछ diabetes या
No, sir.
BP का तो नहीं है.
No, sir.
Hypertension.
No, sir.
ये problem जो है ना,
Yes.
वो आपको कुछ parents को भी है.
Yes, sir. My parents को भी है, sir.
Parents को भी ulcer था.
Yes.
Father को ulcer.
Falsa.
So
Yes,
all
sir.
this
Answer.
conversation is
Rajesh,
going on.
Your diagnosis
and-
is like peptic ulcer. So we'll have to do endoscopy and ultrasound. For that, I'll start you on medication. Pantoprazole 40 mg daily. Once we do endoscopy, we'll give the pilot.
So I just click on the computer and immediately I get everything in a very segmented form. The present history, the past history, everything. What all I've been talking to the patient, very random, comes in this format. And the important thing about it, if you gossip sometimes to the patient, which movie I've seen and all that doesn't come in. It filters out the gossip. So we actually tested this in about 30,000 patients now. It's getting formalized, and we'll be glad to give it to any other hospital which want to use this. If any of the large hospitals, you can. This is going to begin free of cost to everybody, so that we want to create a system in our country where EMR records are accurate, replaced by unnecessary typing and all. What doctors talk come very accurately into an EMR system. So this is one other thing, and the last area where I think AI is going to make a phenomenal difference is in radiological diagnosis. Look at this. This was a patient who came to me. I was seeing him for 3 years. The last time I saw recently was he had a tumor in his pancreatic head. Unfortunately, he had gone beyond surgery at that point of time. But he was saying that, doctor, I've been coming, what happened? We didn't diagnose. We did a CT scan a few months back, 3 years back, and now. The previous CT scan, I went back, asked our head of department, very good radiologist. She looked at it carefully, said it's normal. I sent it to the Mayo Clinic because we have a tie-up with Mayo Clinic, the top radiologist in the world. I sent the previous CT scan and asked him, can you see if you find anything? He said, no, there's nothing. This pancreas is normal. And when I sent this, he said, okay, there's a pancreatic cancer. Then what I did is, we have an artificial intelligence radiology reading system where I put the CT scan onto this. The 3 years back CT scan, artificial intelligence said, there's a likelihood of pancreatic cancer in this patient, keep a follow. See, it was reading something that we didn't read. It was seeing something that we didn't see. This is unexplainable AI, it's known to occur. So I think this is where it's going to make a dramatic difference. Many of our radiologists, in fact, 50% of radiology in our hospital is contracted to AI diagnosis now. And also, look, again, this is another interesting thing. These are beds in ICU in a hospital, extremely costly each bed because they're artificial intelligence bed. In this bed, normally there are beds where the patient lies down, you get everything in terms of temperature, pulse rate and all. But this bed not only gives everything, your ECG, heart rate, but all the metabolic problems. It actually looks at your sweat, your calcium level, sugar levels and all that. And it's integrated with the IV systems which talk to each other. So if your sodium is, say, 120, the bed will talk to the infusion thing and say, okay, put in so much, 3% saline to make the sodium normal. Comes back, then you stop. So this bed is extremely costly, and our administrators, we have like every other hospital, some accounts people who object to this thing. They objected. I said, let's use some of them and see. And what we found was that although it's costly, for ICU bed, normally, again, people who run hospitals know you require at least 2 nurses per bed to make perfect at that point of time. But by using this bed, there was 1 nurse enough for 5 beds. So ultimately, you save cost with very high accuracy. And now, clinical decision, of course, I'm a gastroenterologist. We are using now this AI for locating polyps, cancers and all. But look at this. This is a Nature paper, 2017. This was a New York study where top New York dermatologists were actually shown a lesion in the skin and asked what this lesion was. 25 top dermatologists in New York, and all of them had different tuberculosis, cancer, this and that. They showed it to AI, and AI said this is amyloidosis of the skin, very rare condition, amyloidosis of skin. They took a biopsy and sent it to the histopathologist, this is amyloidosis of the skin. So AI is extremely accurate in visual lesions, and I feel that specialties like dermatology are going to disappear shortly with AI coming into view. So those who are dermatologists, sorry, but this is what's going to happen, but it'll take some time. And of course, our health is now, I think everybody has variables, watch, ring, and all those things are there, variables. and AI is going to become integrated into that. I was actually giving a talk on artificial intelligence and microbiome in a congress in Hong Kong. So I made this cartoon of a smart toilet. You actually sit on a smart toilet and you pass your poop, and what happens is your stool gets analyzed. And stool gets analyzed, tells what is it, because microbiome is everything now. And it says today eat more carrots, increase exercise, and so on. I made this because these toilets are coming. In Japan, they have urine toilets, so I thought this. And when I actually was entering into the hall like this, outside the hall, they already had this intelligent toilet. So they have an AI intelligent toilet now being sold in Hong Kong, where your morning sessions can be quite useful because you don't waste time. It tells you all about your health and brain power and so on. So these data are now going to be integrated and are going to be important. For example, right now I have a watch, I have a ring, I have patches on me just continuously measuring my glucose. I have a cytokine patch on me just measuring my cytokines. All these data are going and getting integrated into the cloud and going to AIG, AI server, which is mixing everything and telling me, okay, be careful, you may get arrhythmia too excited on this DAS and so on. So everything, it gives you a warning. End of the day, I can get a readout of what happened throughout the day. When did I become hypoglycemic? When was I hyperglycemic? Was there any change in heart? What is my VO2 maximum? All these are very important data. And this again is something we are doing practically. And finally, I think one of the criticism against AI was that AI is not compassionate like human beings. And look at this study published in JAMA 2023, where patients who had surgery were asked to call back to the hospital, talk to the doctor or talk to the AI. And most of the patients said the AI computer was more compassionate than the doctor. So you can teach compassion to AI. Of course, there are many challenges, data trust, and this has been mentioned already, you can lose. This is again very, very important that if your hospital is breached, that what happened to AIMS, and as Dr. Jangir was telling us, if your hospital is breached, then the AI data becomes very valuable because there are a lot of important this thing. And if you lose a credit card, and the credit card sold in $10 in dark market, it's called. But if you lose an AI data of health of a person, it is sold for $250. So you can see how much value AI information has. And this happened recently when this intelligent bed, the patient was being monitored in Germany. The Russian spies hacked onto it and completely changed the intelligent bed setting. So the person actually deteriorated because so this can occur. But AI can go wrong. You can see in 2015, the famous Elon Musk said that self-driving cars will come. In 2016, famous radiologist said radiologists will be absolute. But 2025, in AIG, radiologists are still driving to a hospital and then giving their reports. So you can be wrong. There are many pros and cons. I don't want to go into too much of this, but I want to just remind that AI is going to become extremely important. And that's the reason why in our institute we started this large AI department. We have 40 engineers working on artificial intelligence. In fact, this is the costliest department in our hospital. The salaries are very high, consumption of electricity is very high, but I think it's giving us huge amount of benefit in terms of turning our hospital into a very modern one. So ladies and gentlemen, let me show you this. In 2009, the traffic in US was monitored by a cameraman and a helicopter. By 2019, drones came in. So in just 10 years, both the cameraman and pilot both lost their jobs. So unless we upgrade ourselves, this is going to happen. And finally, to remind you what Charles Darwin said, very important for AI in medicine, that it's not the strongest of the species that survives or the most intelligent, but the one most responsive to change. So we as doctors, whatever level, whatever age, whatever specialty, we have to change now. We have to adapt AI in a reasonable way, and I'm sure this is going to dramatically change the way healthcare is practiced. Thank you very much for your attention.
A big round of applause, my friends. I think we can rise in our seats and give a huge round of applause. Thank you, sir. Thank you very much. Dr. Nageshwar Reddy Sahab, thank you. Thank you very much for that beautiful, beautiful address. And now it's my honor and privilege to move to the next guest. And to introduce him, I would like to invite on stage Dr. Sanjay Lalwani ji, who's a senior pediatrician and academic leader with over 35 years of experience at Bharati Vidyapeeth. He has led pediatric subspecialty programs, training over 250 fellows. He runs Lalwani Mother and Child Care, offering pediatric and maternal services. His vaccine research has led to 50+ publications in top journals like the Lancet Oncology and eClinical Medicine. He also established India's first national care for study of immunogenicity of vaccines with DBT support, advancing national vaccine research. He is a driving force behind pediatric academic excellence and public health impact. His legacy is leadership in pediatrics, education, and research. Please put your hands together for Dr. Sanjay Lalwani ji.
Good afternoon to each one of you in this hall. Firstly, I would thank the young Karad couple for making me a part of this Med Harmony Summit, and of course, personal thanks to Parag, because it was he who asked me to be a part of it. This concept of Med Harmony, everybody were wondering what it is, but I'm sure at the end of the day today, when all of you leave, you will ask them when is going to happen next year, because it will be one of its type happening in the country on the annual basis. Lot of issues beyond our own specialities needs to be discussed. As Dr. Reddy said, that if you do not know AI, you will perish. We firmly believe this at our School of Medicine, and we started AI sensitization workshops in last year to all our faculty members, because the more senior you are, the less you think AI, because we are aging, AI is not required. But we conducted 6 workshops, and first we got our faculty sensitized to AI. It was a 2-day session where each and every faculty member got sensitized. And the second thing what we realized was AI is a very important part, because India has a huge database. And actually the AI research can happen in our country. The second part, what we also realized, that young generation are AI savvy. So with thesis in our institute, radiology, 50% of our thesis are AI related now, and subjects like dermatology, ophthalmology, where AI research is going to make big leaps, 25% of our research and our postgraduate students. Beyond this, of today's meet, we have talks on AI, we have talks on patient satisfaction, we have talks on insurance, we have talked on technology, we have talked on government coming in a big way for a large population of ours to get the healthcare, because we spend only 3% of our GDP on healthcare for a huge population. I'm sure this Med Harmony event, which was envisaged and put together, I'm sure that it will blossom like their own logo in years to come, and it would be an event Pune would watch for in years to come. And I must thank the Karad couple primarily for making this happen. I've been given this duty of introduction of the next speaker, Dr. A.V. I think one more thing we must realize, Punekars, most of the hospitals in the country origin from either Hyderabad or Chennai. You look at all chains of hospital, most of them. We are supposed to be a state which is progressive, and Maharashtra has hardly given any chain of hospitals. We need to really wake up and see that with this type of healthcare we have and the modern state we are supposed to believe, with the way India is going to progress, I'm sure there are a lot of stalwarts who have a big hospitals, whether we can actually make centers all across the country in years to come. Dr. A. Gurava Reddy is a renowned pediatric surgeon with 33 years experience and performed more than 75,000 joint replacement surgeries.